So my name is Dr. Gregory Kabadi, and I am the country coordinator for the D4H in Tanzania on the side of the CRVS. We had Philip and Don who visited Tanzania before D4H started. They came and then they engaged all the high-level people, the Minister for Health, the Minister for the local government, and all the senior government officials for the, those who are dealing with, in one way or another, the civil registration and vital statistics. So after they finalized that high-level engagements, then we had the first stakeholders meeting. When we convened that meeting, we asked people on the priority interventions that they wanted to have the support from Bloomberg Data for Health initiative. And then they pointed out 7 priority interventions, one of which was the verbal autopsy. I have been in the business of verbal autopsy, so I would say, from 2000, when I joined Philip Settle, Dr. Philip Settle, in the Adult Morbidity and Mortality Project. By then we had 3 DSS sites that we were running as the project. DSS stands for Demographic Sentinel Surveillance. Sometimes they are called HDSS, which stands for Health, Demographic and Sentinel Surveillance Systems or sites. In those 3 sites, verbal autopsy was the key intervention that we were doing, in addition to the sensors, because as you start the DSS, the first thing would be to run a baseline enumeration of all the people, and then you actively follow them up with a mortality surveillance. That is the verbal autopsy. The government could only rely on mortality data from facilities, hospitals, health centers, dispensaries and clinics. So that's where the government primarily obtained its mortality data for policy formulation and program management. When D4H came to Tanzania, the idea here was to have the verbal autopsy being piloted to be part of the national CRVS, instead of being run in parallel or at a small scale by, NGOs and institutions and projects. Now, can we do this at the national level and have it integrated into the routine data systems, that is the Health Management Information System, the HMIS? So the first approach was to now start finding ways to pilot this first, to see if it can be done as part of the government routine systems. We selected 10 sites, and with sites I mean 10 wards from 5 districts, which were from 3 regions around Dar es Salaam. It was a convenient sample. The idea here was not to select a national sample, because the entry point would be to find out if it works with a mixture of urban, rural settings with high mortality rates. And then we started running the verbal autopsy interventions from the Ministry of Health, and as part of of the routine data collection system. So we trained people, the verbal autopsy interviewers, and then we gave them the tablets, and then we also followed them up with regular supportive supervision, and then they started running. We currently have close to 1,000 deaths from the time we started, I think May or June 2017. And so we have seen that it is possible. And from that, we went ahead now to go and try to demonstrate by having an entire region we call Iringa region, which is in the southern highlands of Tanzania, together with our colleagues at the civil registration agents we wanted to go and pilot or demonstrate three things. Number one, whether it was possible to decentralize what we call the death registration system. The key issue would be to register all the deaths in that region, at the same time issuing free death certificates for all the deaths that were registered. The Minister of Health wanted to have all those deaths followed up with a verbal autopsy interview to eventually come up with a probable underlying cause of death. That will be done for all the deaths that are occurring in communities. And for the deaths that will be occurring in facilities, we would run what we call the medical certified cause of death through the physicians who are trained on how to do that. And we have run this for more than a month, and we are seeing very good results. We had the permanent secretary of the Ministry of Health coming to hand over the 106 tablets that were handed over to the verbal autopsy interviewers from the entire region. And so after that, we had trained them before, and then we started collecting the data. So we are seeing that it is possible to integrate the verbal autopsy interview within the routine data systems of the Ministry of Health. And so what remains thereafter is if the government of Tanzania will have enough resources to scale it out. But if they won't, then scientifically we have agreed with our technical advisory group leaders, and here we mean Professor Don DeSavigny, it is possible to set up a national representative sample where you can have some few wards across the entire country, as opposed to SAVI. Now these ones will be running what we call the civil registration and vital statistics VA system within the government structures. On the side of how we see the possibility of having the verbal autopsy being sustainable, we've tried our best, as we are doing this within the Ministry of Health, of having to do two things. Number one, we were able to include or to have the training materials of verbal autopsy included into the over 70 community health workers training colleges across the entire country. So now all these community health workers who enroll in these colleges, and it's 1 year compulsory, these community health workers will be equipped with the competence of having to conduct eloquently and efficiently the verbal autopsy interviews. So they will be graduating every year with the competence skills of running verbal autopsy interviews in their communities when they go back. So I think that's where we stand.